Welcome to the reading of my thermography results. If you haven't heard of thermography before, I hadn't either until I met Shanna, and we happened to meet at a networking event, and it was very interesting because we have the same goal in mind, is to make everybody as healthy as we can make them or help them be. So thermography is a preventative measure, and I don't know all the history behind it, and I'm actually including some links below where you can check out the history, but really what it does is it does thermal imaging of your body so that you can see where there are maybe some abnormal heat patterns. So when we have inflammation in our bodies, that is a signal that something's going on. So when we have inflammation due to an injury, due to cancer, anything like that, that is what is picked up on thermography. So I met with Shanna last year and had her do thermography on my body, so a total body scan from top to bottom. A lot of women opt for this because they can do thermography without doing a mammogram. It's in place of mammograms, and it can see a lot of abnormalities before they ever turn into anything that you would really need to get biopsied or anything like that. So you can see with vascular patterns, your breast health or any other health within your body. So I decided I wanted to share all of my results with you guys. So Shanna and I, in the next part of this video, Shanna and I do a little Skype call where she reads all of my thermography results back to me. So if you have a thermography scan done, what happens is somebody like Shanna, and she offered everybody a discount if you mention this video, so it's a $50 discount off. So she operates in South Carolina and in Florida. But anyway, so you find a thermography technician and they do the thermographic imaging. And really it was, I'll just go into detail here because you're going to see my whole scan. So you just wear panties, that's it. And she takes a bunch of pictures of you naked with a thermography camera, or thermographic, either way. So it's just a bunch of pictures that she takes. She has you pose in certain ways and takes the tops of your feet, the bottoms of your feet, every part of your body. And then all of those images get sent off to doctors, and they read your images, they analyze it for you, and then they send a report back. So that's what we're going to be going over, is my report. So you'll see where I have some areas of concern, and it's things that I never would have picked up on before. There's no pain that I have in my head. You'll see that there was a little temperature difference thing going on up here that has to do with my carotid artery. So it could be nothing, it could be something, who knows. So I'll have it checked out by the doctors. You'll also see that I have some inflammation in my shins and in my ankle, and that's probably due to my minor scoliosis, and so I have some imbalances in my body. So for anybody it's really for anybody, it's a preventative measure to have at least a baseline scan, because you never know what's normal, what's abnormal. I may have another scan and they may realize that just one side of my head is colder than the other or something like that, just on a regular basis. So it's nothing to be worried about. So it's very interesting. Take your time to look through the whole thing. I know it's kind of boring because it's not your body that they're analyzing, but there are so many tidbits of information through there that aren't even related to my body. It's just other patients that Shanna has seen, different case studies, that kind of thing. So it's really one of the most interesting pieces of technology I've come across in a long time. So I highly recommend you listen to the whole thing. And then if you have any questions, let us know. I'm including all of Shanna's contact information in the section below. And like I said, she's going to offer $50 off to anybody who mentions this video. So I hope you enjoy learning all about the body, and let us know if you have any questions. All right.
Hi, Stephanie. How you doing today?
Great. How are you, Shanna?
I'm very well, thank you. Do you have your report ready for us to review?
I do.
Excellent. All right, so what I'd like to do is go over your clinical impressions and recommendations, and then we'll kind of go down to your images so you can relate the two.
Great.
Okay. And I know we're doing a bit more of a thorough report review today. So normally I just go over the abnormal findings, but I'll go over all of them with you.
Thank you.
You're welcome. Our interpreting doctors, they look at the head, they look at the sinus area, and they also look at the inner canthe of the eye. and then they try to see if maybe one side of the sinus is hotter than the other, or the same with the inner canopy of the eye. And for you, yours were of equal temperature down here. So they look at these spots right here. Can you see my mouse okay?
Yeah,
Great.
I can't see the screen.
Oh, well, let's change that. Now can you see the screen?
Yes.
Excellent. All right, so the inner canopy of the eye right here, and also the sinuses, are what the interpreting doctors are looking at for the head. So sometimes, you know, the sinuses will have an increased temperature where normally it is cooler in the sinus area. An increased temperature could indicate a sinus infection. There's also some patients that have the inner canopy of the eye right here and here hotter on one side than the other. And, you know, that could be a number of things. Ultimately, the patient needs to talk to their physician to figure out what could be causing that if that's the case. Okay, the next section is the cerebrovascular section. And for you, it says that you have hyperthermic findings over the left forehead that may be consistent with left carotid insufficiency. And the delta T is at 0.7 degrees. Well, what does all that mean? Let's go down and I'll explain it with the picture. With our software, our interpreting doctors, they're able to draw these circles on your forehead, and then the software takes temperature readings within each circle. So the ROI1 means region of interest 1, and that's represented, the red square correlates with the red circle over here. And the minimum temperature within that red circle is 32.83, the maximum is 33.86, and the average is 33.36. They do the same thing for the green circle. They came up with 32.66, and then ignore that minus sign. You just take the absolute value. The difference between the two averages of both sides is at 0.7 degrees. So that's considered abnormal because what's considered normal is at 0.3 degrees Celsius or below. And based on that finding, the interpreting doctors are telling you that they want you to clinically evaluate that area, and they're recommending a follow-up screening in 6 months. Now, I know we've both been really busy and it was hard to get in touch, so you do want to get that checked out soon. If you could go ahead and make a note, okay?
Okay.
All right, the next section is, let me go back to that one and just explain a little bit more about the cerebrovascular. So this reading is so important because on the forehead you have vascular patterns that are called branches of your supraorbital artery. Those connect down into your internal carotid arteries. So if you have one side of the forehead that's colder than the other, it could indicate possible blockage in one of your carotid arteries. And if that were the case with this reading, it would probably be on the left side because you can see all this blue. That means that the left side is colder than the right. But it also and probably is more so due to some trauma that you've had throughout your life to your head, scar tissue, or eczema. But ultimately, because it is an abnormal reading, it's not something you want to ignore.
That's so interesting.
Yes, it is very interesting. And I actually have, we have this slideshow of extreme case studies. Maybe you and I can meet another time and go over that. But there's this one gentleman, and his forehead was so cold on one side that it was black. So if you look at your picture down here, your nose is black, but that's because it sticks out. You know, it's not close to the surface of your face. But this guy, he had the right side of his forehead was completely black, and it was because he wasn't getting any blood flow up on that side, and he actually passed away a week later from a stroke.
Oh, wow. So it's just so interesting because I don't know that I ever would have had indication that I needed to get this checked out without the thermography. Like, how else would you even know that, you know?
Yeah, and that's what's so great about thermography is because it's possible early detection that could save your life. So if there is something going on now that could be a problem in 5 years and 10 years down the road, you can, you know, address it now and figure out what you can do to improve your health now rather than have an issue down the road.
Wow.
All right, the next section is the oral cavity, and it says that you have mild oral hyperthermia seen in the right mandibular region, and a dental referral is recommended. So the oral cavity is referring to the mouth. And before we go any further, I'm just going to quickly look at this one as well because it goes with the same picture, the TMJ. It says the impressions are no thermographic findings to correlate with patient concerns. So I guess you had a little bit of TMJ concerns. And
I clenched my teeth. It's not so much
the jaw
grinding. But,
Well, thermographically at that time you weren't showing any signs of it.
Oh, great.
But for the mild hyperthermia around the mouth, see this white arrow pointing to the right side of your mouth?
Yes.
Basically all this yellow and even some of the darker green should not be around the mouth. I recently went to a holistic dentist and I got my silver fillings removed because they have mercury in them and that slowly seeps into your system. But she gave me quite the education about periodontal disease, and the hygienist really harped on me that I need to brush and floss after every meal. And I think I've been overdoing it because my teeth have been unusually sensitive since then. But anyway, they really expressed to me that if you don't do that, that the bacteria from the food can actually cause pockets in the gums or periodontal disease. And then plaque can seep into those pockets, get into the bloodstream, and actually clog the heart, and also get clogged in the bloodstream, leading to the brain, causing a stroke.
Interesting.
So I was like, wow. And it can also cause lymphatic congestion that we're seeing in the neck. So it's like, why worry about all this stuff now if I don't have any symptoms? Well, with thermography, whenever you're showing inflammation like this, it's kind of, for me, it was the slap in the face I needed to, learn about oil pulling and make sure that I'm brushing and flossing at least twice a day. Like I, of course, was brushing at least twice a day, but flossing I was slacking on.
Yeah. And
she just really made me understand that, all right, this, because I also have some oral inflammation going on in my thermography and some lymphatic congestion. But there's definitely a lot that we can be doing now to avoid future issues. So you probably want to send this to your dentist, and you can let them know, either at your next cleaning or, if you just had one, if you want to make another appointment, go ahead and let them know that you want to discuss this report and see what steps you can take now to get rid of some of this inflammation we're seeing.
Okay.
All right, so we just kind of went over the lymphatic system, but it does say mild congestion in the neck, submandibular, and supraclavicle regions. Lymphatic drainage therapy was recommended. Have you ever seen a lymphatic massage therapist?
No, I haven't.
All right. I recently found a few at Earthling Day Spa down in Charleston. So these lymphatic massage therapists, they have special training about how to drain the lymph nodes. I don't know if you know, but we have 600 to 700 lymph nodes throughout our body. And what they are is basically on our veins, they're little sacs. And their job is to pull out bacteria. So when there's bacteria in the mouth, and out of the 600 to 700, we have 200 to 300 in just our neck and our head. So these lymphatics, they pull out bacteria from the blood because they want to protect the main organs. They want to protect the rest of the body when that bacteria in the mouth is draining down towards the heart, because the heart pulls the blood, pumps it throughout the body. So to clear that up, you could see a lymphatic massage therapist, or on your own, you could do dry brushing. Have you ever heard of a dry brush technique? Good. Do that before your shower. Or even, I recently bought a mini trampoline. You can jump on that for like 10 minutes a day, and that really gets your lymphatics to open up, and then you drink a lot of water and flush out those toxins.
Okay.
Awesome. The next is the thyroid. It says that your findings were within acceptable limits. And it was recommended that you follow up in 6 months for the thyroid.
Now, why would they want me to follow up in 6 months if it was within acceptable limits?
I think because you have overall lymphatic congestion in the neck. See how it's like kind of mildly yellow and green throughout your neck?
Yes.
So it may have been difficult for them to get a thyroid reading on you. So that's probably why they said come back in 6 months. The next section is the breasts. It says normal thermovascular patterns are on both breasts, and they recommend a 12-month follow-up. So that's really good. Actually, it's more common than not that women have various vascular patterns in their breasts that our interpreting doctors want to check out. And they'll usually say, you know, come back in 3 months or come back in 6 months. Because if they see any abnormal vascular patterns, they would want to monitor those and make sure there aren't any significant changes. I don't know if you know, but breast cancer actually doubles on average every 90 days. So if they see a vascular, yeah, it can be really quick. And that's why it's so important to listen to these follow-ups, because, you know, some women who don't, if they double on average every 90 days, that's the average. Some are more aggressive. So that's why they want to make sure there's not anything increasing in temperature dramatically that would need to get taken care of right away through, you know, your doctor's treatment, of course, which could be surgery or biopsy or what have you.
Okay.
The hormone assessment, they gave you a normal rating. This was done quite some time ago, so now they're elaborating a lot more on these hormone assessments, and they're giving everybody a rating on a scale of 1 to 10. So we'll see at your follow-up, you know, where you're at. Hopefully it's still at normal, but typically everyone's on that scale, which means that there's room for improvement. So a lot of my patients, you know, who I always ask them how much they're exercising, because I know how important that is. So I would definitely send some of them to you, you know, if they're telling me they don't exercise at all, or, you know, maybe they just need your motivation. But I know that you have a lot of clients and have had a lot of success with them. So yeah, it's definitely important to, you know, check out your overall lifestyle. What are you eating every day? You know, what products are you using on your body? Have you ever done a detox program? Do you ever do detox programs throughout the year?
Yes, I do. I use the Isogenics cleanse.
Very good. Good. The abdomen, it says that there's a lower left abdomen has an expression of mild hyperthermia. Evaluation of underlying anatomy by a physical exam is recommended. So the lower left. Let's see here. Okay, so right here they're saying that's your right. Lower left. I don't know if they're talking about this and just didn't put a marker, but that's interesting. I'll have to ask them about that, because typically they do draw an arrow to the area of concern. It very well could have been this vascular pattern over here, but where they have this arrow pointing is actually right where your liver is. So I don't know when you had done a detox program before this report, but typically if patients are showing any inflammation over the liver, I would recommend a detox program for them.
Okay, I hadn't done a detox. I hadn't done the cleanse prior to this, and I was actually getting ready for a photo shoot, and I was putting my body through quite a bit of extra stress. So
it could very well be from that.
Yeah.
The next one is the spine, posture, and the gait analysis. It says inflammation is seen in the thoracic and the cervical spine. Evaluation by a doctor of chiropractic or a physical therapist is recommended. So if we go down and we look at the spine, this color palette that the interpreting doctors chose for you shows red, that's the hotter points of your back, and then the white within the red is even hotter. So you can see the center of your spine is white hot, as well as the neck up here. And you're saying you're putting your body through a lot of, you know, preparation for your photo shoot. Perhaps working out extremely hard caused this inflammation? But
Probably.
ultimately,
It was within like 2 weeks of the photo shoot, so you can see how these things are not very healthy.
I see. Do you ever see chiropractor, massage therapist, physical therapist?
Mm-hmm.
Good. Very good. So what I would do if I were you would be to show them this report and say, you know, based on this report, is there any way you can adjust me differently, or is there anything you can recommend on how to alleviate some of this white hot inflammation we're seeing in my back?
Okay.
The lower extremity is, it says bilateral tibial inflammation is present. The red arrows show areas of questionable vascularity represented thermally. These are most likely normal vessels. The plantar surface of the right shows signs of inflammation consistent with abnormal gait and or weight-bearing anomalies. So it could be your posture or how you're bearing your weight from your right to your left side. The toes of the left foot are colder when compared bilaterally and may be indicative of a circulatory dysfunction. And they're recommending that you see a chiropractor or a physical therapist.
Okay.
And then your hands, upper extremities say it's normal. If we go down and look at the legs, you can see it said bilateral tibial inflammation. So both of your shins are inflamed. That could be due to working out, but it also could be how you're bearing your weight. So that it'd be good to get an analysis from your chiropractor about your posture and your gait. Usually they do that when they first meet you. So do you recall doing one with them?
Yes.
Okay. So
yes, I have abnormality. And I don't know if you can see it from the picture, but my hips are uneven. So one's higher than the other. So that throws everything off.
I see. Is it the right one?
Mm-hmm.
Yep. They also marked these questionable vascular patterns on your legs, and it's probably due to the stress of working out. But at the follow-up screening that you do with me, they're going to want to monitor these vascular patterns and make sure that they're not getting worse. And if they were, they would have you go for an ultrasound. Hotter. And they would be darker.
Okay, but that would be due to blockage, or what would that be from?
I'm not exactly sure. You would definitely want to ask your physician about that, but I can tell you that when my patients have extremely abnormal and very hot vascular patterns on their legs, the interpreting doctors will send them for an ultrasound, and that's to check for deep vein thrombosis to make sure that there's not a blood clot in them.
Okay. That's actually how my great-grandmother passed away. She had a blood clot in one of her legs. Like that.
Really?
Mm-hmm.
So it's definitely something you would want to ask your physician about next time if these vascular patterns are getting worse as a precaution.
Okay.
The bottom of your feet, do you recall wearing any like unusual shoes, or do you usually wear really comfortable shoes?
I usually wear very comfortable shoes, and I like to not wear shoes, so.
Me too. Okay, well, your right foot definitely has a lot more inflammation going on than the left. They both have an unusual amount of inflammation. This could have to do with your hip, you know, because that's going to throw everything on that side out of whack. Also, your ankle over here looks a little bit more inflamed than the other one, but they both look inflamed. And then if you can see over here, your toes are black on the left foot compared to the right. They're a little black, but these ones are really black. So it's like, what's going on? What's causing that? You know, was it your shoes? Is it your spine? How your hips aligned? Something's unusual there.
So all of this is really, really great information, especially for somebody who's a, well, for anybody, but especially the runners. I have a lot of clients who, or even just fans who end up with overuse injuries, or they have these nagging problems, and it's these imbalances that continue to cause inflammation. So this is just, it's really good to take note, especially I do have some people who are kind of, and I was too, kind of addicted to running, and even though it hurts. And so this is, that's I say it's like not rotating your tires on your car. I don't know if you've ever done that. I did it once in college when I was, and anyway, I ended up rubbing some really, really, really bad wear patterns on my tires, and I kind of feel like it's the same thing. If you keep doing the same exercises and you have some misalignments, then you're going to end up with tons of inflammation. So
I agree. I get too bored doing the same thing, so I like a huge variety, from yoga to Pilates to biking. I do jog sometimes, swimming, paddleboarding. Like, I like switching it up for sure.
Yeah. So does your body.
Yeah. I know, it makes sense. I think I went on a hike with flip-flops not too long ago. It was unexpected, and my feet started to get sore, of course. And my friend was like, change your walking pattern, walk on the sides of your feet for a little bit. And I did, and it totally went away. And I was like, okay, that makes sense.
Oh, that's great.
Yeah. So I know you had asked earlier about, who should get this screening and how, you're not in an age where they would recommend a mammogram yet. I wanted to share with you that I have, patients who are all ages. People always ask me who my target market is, and I say anyone who's breathing or anyone who can pose for the camera, because thermography is possible early detection that could save your life, but it's ideal for prevention. Unfortunately, people can get cancer at any age, and one of our interpreting doctors started screening his patients' kids for free, and I thought, what a great idea, whereas early detection saves lives. And he's done by now like 65, and unfortunately he found breast cancer in an 11-year-old girl. So, and there are all sorts of different cancers out there, and unfortunately we're not all 100% healthy, although we should be, but it doesn't usually happen. So that's why I think it's so important to get started at an early age and kind of monitor yourself year after year, and then you can compare to the year before and see if there are any significant changes. See if there's one area that you need to get checked out. So
then you do this for men, and you do it for women, you do it for children.
Yeah, we recently had a testicular protocol added that I've been doing. So I have screened a few men for that, and unfortunately one, he did come up with an abnormal finding, so the interpreting doctor said, you know what, go get that ultrasounded, and I haven't heard back from him yet, but it is considered experimental at this time, but it is totally safe. With thermography, there's no radiation that could cause cancer. There's no compression, like with mammography has compression that if there were cancer present, you'd have run the risk of spreading it. Or some women have implants and they run the risk of bursting them. So it's wonderful that it's totally safe for the body. And, unfortunately, women in their 20s and their 30s, if they do get breast cancer, they're less likely to survive because they do not get mammographies, it'll go undetected for too long, and then it's usually at a much later stage once it's found. And it also can be a quicker progression with younger women based on, I guess, their bodies and their age. I'm not sure, but younger women.
Our cells are replicating so much faster than versus whenever you get a little bit older, things kind of slow down a little bit.
I think that's the case, yeah.
Yeah.
Yeah, so it's definitely ideal for everybody, and it's changed my life completely because I had no idea, eating a sad diet, the standard American diet, was so bad for me. I'd have a salad maybe once every other day. I thought that was good enough. Still eating like all these pastas, dairy, and sugar, but I've totally changed my life because of thermography.
Yeah, that's great. I have a lot of my clients come to me primarily to lose weight is kind of like the number one thing. And I mean, some people do understand that they really need to get healthy. That's their first thing. That's their first goal. But a lot of times it really is to lose weight. And then the way we get to that is by doing all of this other stuff. And I do have a lot of clients who come to me and they have I can just tell that they have so much inflammation going on in their body just by the symptoms that they tell me and the things that they're experiencing. And I think it's really cool that you guys do, you check out the thyroid. I have a lot of clients that they're really putting their bodies through a lot of stress just through lifestyle. So it's nice to have them have those areas checked. I can't wait to get the hormonal scan done again, or well, I guess they did.
More detailed evaluation.
Yeah, that's really exciting for me because I don't think people really understand how much of like a science project our body is, and everything depends on those chemicals in our bodies. Hormones run everything in our bodies. And I do see a lot of people too who will come to me for weight loss, and it's, they kind of beat themselves up. They're like, oh, I shouldn't eat this because it'll make me gain weight, and I should have worked out or whatever. But really, they are kind of eating in a pretty good way, or they are getting their training in, and maybe some of them are even overtraining, but they have imbalances in their hormone levels. And it just throws everything off. And it's almost like a futile effort to do those exercises if your chemistry is off.
For me and for a lot of my patients, seeing yourself thermographically can be a huge wake-up call. I've had several patients tell me they've lost 20 pounds, from their baseline to their follow-up, because just from listening to the recommendations in the report and improving their diet and working out, shocking, right? And yeah, it's really been a wonderful journey. I've had several patients tell me they quit smoking after seeing their thermography report. So hearing those things is
like one of those
amazing.
non-scale victories too. Like I don't like the scale, right? Like that number on the scale, who cares what that says? But what are all the other things that are going on? And I think this is kind of cool. Like I want to see how little red I can get on the next scan. Right?
I know, it's a goal. It's a goal to improve your thermography, which in turn improves your health. And I definitely want, I'm excited that you're going to share this with your clients and your fans and your friends. Thank you so much for that. And I want to offer them a $50 discount if they mention this video when they sign up with me. I have my own business in South Carolina and throughout Florida. So if they sign up at any of my labs, they'll definitely get that $50 off. But if they want to go elsewhere, that's certainly up to the location. But they can find all of our locations throughout the world on btiscan.com. Stands for Breast Thermography International, so it's btiscan.com.
Okay, great.
And then we need to go ahead and book your follow-up.
Okay.
So if we want to do that, we'll have to get off here because I do take a $50 deposit, so I don't want to have your credit card information on this call.
No, thank you. I shared my body scan with
That was enough for today.
You know what? I figured, hey, I've done these competitions. I have pictures in bikinis, so what does it matter?
Yeah, basic, close enough, right?
Yep.
All right, Stephanie. Well, thank you very much. You're welcome.
I appreciate it.
All right, me too. Thank you.